Thank you, Lori. I guess the aim of my talk today is primarily to hopefully stimulate some questions or hopefully answer some questions. And I'm sure that among the audience and among the faculty members at Stanford that such questions will be answered much better by those who are involved as opposed to being a patient. As I said, as Lori said, I am a retired gastroenterologist, and I had a long journey with prostate cancer. In reality, my brush with cancer had started even back in my 40s, not so much because of myself, but because of a very strong family history. A father, an uncle, a cousin on my father's side, and a brother who all had prostate cancer. And so being in the medical field myself, I got really a little more excited about getting my PSA determined and run. And for a very long period, back from the 40s up into my mid-50s, all the numbers had remained within a reasonable range, undetectable. And it wasn't until 2008 when I started noticing that the PSA values had started slowly increasing. Now, around that same time, I had become a little more, oops, I pressed on something. I had become a little more involved with sports activities, so biking to work 3 times a week. And in my mind, I thought with the rough roads in San Jose, where I live, maybe that was in any way irritating the prostate, and that's the reason why the PSA was going up. Sure enough, wasn't the case. I stopped biking for several weeks, repeated the values, no change in my values. So at that point, my local urologist in San Jose decided that probably it's time for us to go ahead and get a biopsy done of the prostate. And obviously with the family history that I came with and the rising PSA, I proceeded on with the biopsy. I wouldn't say that it was a painful or irritating procedure. It wasn't something that I would do every other day, but certainly it wasn't something terribly bad. I ended up with a 12-core biopsies of the prostate with an ultrasound guided, and the results came back negative, no evidence of prostate cancer. We still didn't have an explanation for the rise in the PSA. That went on for a couple of years, and the numbers kept increasing during that time period. Ultimately, when the values reached about 13 or so nanograms per milliliter, which was significantly elevated compared to what my baseline was, I had to go through a second set of biopsies, and sure enough, in the very far anterior part of the prostate, on the left side was an adenocarcinoma of the prostate. The pathology itself read, and I'm sure you get exposed to the term Gleason scoring, the pathology was read as a 3+3, which meant that obviously there was a cancer, but on the good side, it wasn't an aggressive cancer. It is then that I decided to take my care from my local urologist into Stanford, and I had the really fortune to meet Dr. Harsha Gill, who essentially went out of his way to try and help me, saw me after hours because I had a busy schedule caring for patients. And long story short, he presented me with the options. One option, given the fact that this is not a very aggressive tumor, would be to do a follow-up biopsies on a 6-monthly interval and make sure whether the condition remains stable or not. And then decide, in light of that, decide whether we need to go a little more aggressively. Or option number 2 was to actually go ahead and proceed with a robotic prostatectomy at a scheduled date. I did not feel the issue of repeating biopsies on 6-monthly interval was something that was fun to write up for, but that's an option. That was an option and was presented with that. And I didn't like the proverbial sword over my neck, or for that reason, over my life, to delay the management and just keep watching it. So we agreed on proceeding with a robotic prostatectomy. Now, it's been about 7 years since my prostatectomy, and I look back at it, and it really was not a bad experience. I can dare say it very honestly that the experience was not a bad one. The worst part of the whole experience was actually having the Foley catheter in place for 11 days after the procedure, and what a relief it was when it had to be taken out. I met with Dr. Gill and his staff after the surgery to go over the pathology result, and it is at that time that I realized that the tumor could not be safely resected completely, because the pathologist saw that there was evidence of tumor, 3 fingers of tumor, if you will, that were still left behind, and it was not possible to safely take that out at the time of the surgery. So what we decided, Dr. Gill and I, was to basically monitor the values and see where things are. Percentages were that maybe 50-50 chance that you don't need to do anything about it, or that things start increasing, the PSA starts increasing again, and you'd need to be managed differently. So for a period of 5 years, the numbers remained low. Now, I always had this concern in the back of my mind that even after a radical prostatectomy, the numbers were not undetectable. There was always a small amount of PSA that was detectable at all points throughout that journey that I had. But and the explanations that was given to me in my research of it was that this is probably the urethral PSA or some PSA coming from somewhere else. Don't worry too much about it. After 5 years of these follow-ups, the numbers slowly started increasing. And we're not talking about numbers going up into the high ranges of 8 and 9. No, we started at 0.04, and slowly the numbers were going up into a range of tripled, literally tripled in a period of a few months. So with that in mind, this is my conversation with Dr. Gill was it's time for us to really go ahead and initiate therapy in the form of radiation therapy. I was lucky that radiation therapy was available in South Bay, in San Jose, close to where I lived. And I dare say that the experience was a truly very benign. I could not really have anything negative to say about the experience, be it in terms of side effects or be it in terms of the actual procedure itself. I was under the care of Dr. Swift, started initially by getting a CT scan done, localizing whatever tissue is left, and then focused radiation therapy to that area. Completed those sessions. It's been about 18 months now, and for the time being, and so far, my PSAs have remained undetectable. So in a way, I look back at this whole journey. It wasn't like a shocking thing. Now, I have other family members who have had different types of cancers, and I dare say that my journey was really not something that I probably expected. It was more so the when rather than the if, and I sort of expected that this is a journey that I'll have to face. I was lucky enough to be in the hands of people like Dr. Gill and Dr. Swift, who essentially helped me through that journey. The more I got exposed, obviously, throughout this period to the prostate cancer management and the skills of the people around me, the more I realized that the future is an absolutely wide open. There's a lot of information, there's a lot of changes, Interestingly, my brother, who had his prostate cancer after I had it, had a completely different type of treatment that he decided to undertake here at Stanford as well. So the promise is, unlike any other form or other forms of cancer, it is really not the kiss of death. I have not felt at any point in this journey of 7+ years that this was something that is, I need to really put my papers in order. This is going to be something that is lethal. So thank God to that being the case, and also for the excellent skills of the physicians around us who have taken care of me. I think that that's basically my journey as it stands. I hope it ends here as opposed to really another form of recurrence or otherwise, but not without. But should it be, I know where I'll be going, and I know what help to seek. Thank you.